Hi everyone, my name is Will Brown, and I'm here to talk you through the APAC Liver Disease Alliance infographic, now in its second edition, highlighting the progress that's been made since its first launch in 2023. The APAC Liver Disease Alliance is a multilateral platform that brings together diverse stakeholders across Asia Pacific. Its mission is to reduce the growing burden of liver disease and its social and economic impact in APAC. Vista Health is proud to be the knowledge partner of the APAC Liver Disease Alliance. Together, we've worked to raise awareness, strengthen political will, and support national efforts to eliminate hepatitis and reduce the burden of liver cancer across the region. Viral hepatitis is often called Asia's silent emergency for good reason. Hepatitis-related illnesses are killing over 800,000 people in APAC every year, counting for more than 60% of the global hepatitis death toll. To put it further into perspective, in our region, the death rate from hepatitis is roughly 3 times higher than that of HIV/AIDS. Now, turning to liver cancer, HCC, which is primarily caused by chronic hepatitis, is the 5th most common cancer in APAC, but the 2nd most deadly cancer here. These statistics underscore the urgent need to address hepatitis and liver cancer and address them together. If we don't act now, the health and economic toll will continue to rise. Now, to develop this updated infographic, our team started by conducting a targeted literature review covering the latest available data and policy. Leading hepatitis and HCC experts from across the region were also closely involved in shaping the infographic. We've engaged clinicians, researchers, and policymakers to review and validate findings, ensuring that it's clinically and policy relevant. Over the past couple of years, there have been notable developments in policy, programs, and outcomes across different health systems. We highlight those changes, improvements in national plans, new funding commitments, pilot programs scaling up, and other health system advancements that have occurred since that first edition. So let's take a look. Since the 2023 edition, several health systems have made encouraging progress in their hepatitis elimination efforts. These developments from 2022 to 2025 are captured in the infographic, indicated by the upward pointing triangles in the table. First, Thailand. Thailand has shown significant improvements across multiple pillars. They've strengthened their national action plan, increased funding allocations, and they've demonstrated stronger political commitment to hepatitis elimination. Similarly, we've seen some other health systems take steps forwards. Some have launched new screening campaigns, and others have improved access to hepatitis treatment. That being said, most APAC health systems are still not on track to meet the WHO's 2030 elimination targets for hepatitis B and C. This is a reminder that a concerted push and greater urgency are still required to truly eliminate hepatitis as a public health threat in our region. For HCC, in 2025, Japan remains as the gold standard for HCC surveillance and management in the region. Elsewhere in APAC, we are seeing improvements in HCC control efforts, particularly in terms of political commitment and awareness. Several governments and health systems have started to prioritize HCC as a specific public health challenge linked to hepatitis. And more health systems now have HCC mentioned in their national cancer control plans or hepatitis strategies. And some have begun pilot programs for screening or are improving clinical guidelines. Taiwan is one health system that's made notable strides. Today, Taiwan is also enhancing its HCC surveillance and management. They've integrated HCC surveillance into their healthcare system and improved funding for liver cancer programs. And they're also leveraging their strong hepatitis elimination progress to reduce HCC incidence in the first place. It's a really encouraging model of integrated care that other health systems can learn from. While awareness and commitment are improving across the region, not all health systems are providing sufficient infrastructure, funding, and access to tackle the problem. Progress is being made, and we celebrate those gains, but there's a clear need for continued efforts. Now, based on these latest insights, we continue to advocate for 5 key recommendations to guide action across the region. First, strengthen national action plans with clear goals, budgets, and governance structures. Second, to expand screening and treatment, integrating that into existing health systems. Third, secure greater funding through universal health coverage and catalytic funding models. 4, implement strong HCC surveillance and treatment pathways, drawing from best practices like Japan. And last but not least, raise public awareness and secure political champions to drive momentum to tackle stigma. These steps are vital to creating an integrated, sustainable response to hepatitis and HCC. The new 2025 APAC Hepatitis and HCC infographic is now live and available on the Alliance's website. This is the culmination of the data gathering and the expert work we described, and it's a comprehensive visual tool. Please download, share, and advocate. Whether you're a clinician, public health official, a patient advocate, or a policymaker, this tool is designed to support your work. Share it with colleagues and decision makers, post it on social media or your organization's website, and use it in presentations or community forums to spark conversations and advocate for change. Finally, we'd just like to thank all of the contributors and the partners who made this second edition of the infographic possible. Thank you all, and thank you all for listening today. Goodbye.